The Senate Committee on Health, Education, Labor, and Pensions will please come to order. We don't have a quorum.
Yeah, but you can start the discussion.
We don't have a quorum yet, but we'll start with our opening statements. That's okay? Yeah.
We can waive. They can waive it, so they said they'll waive it.
Sounds great. Okay, great. Today, the committee is considering multiple bipartisan pro-worker, pro-family, and pro-patient bills strengthening Americans' access to quality health care and retirement benefits. I really appreciate colleagues working on these bills. When the committee sets politics aside and work together, we can deliver real results for American families. I hope this to be the first of many markups that will move down dais member priorities from both sides. We're voting on bills to strengthen employee stock ownership plans, ESOPs, empowering workers to have a stake in their company and build wealth for themselves and their families. Senators Marshall and Kane's Retire Through Ownership Act clarifies federal law ensuring ESOPs can sell shares of their company to employees without the fear of frivolous lawsuits. My Employee Ownership Representation Act adds 2 new ESOP board members to the ERISA Advisory Council. Senator Hassan is offering an amendment to this bill, which I look forward to supporting. It improves the bill, and I appreciate her thoughtful engagement. I also want to note the committee is not voting on the Employee Ownership Fairness Act to authorize ESOPs to contribute into 401k plans without exceeding contribution limits. Every witness last week underscored how this strengthens employee ownership and puts more money in workers' pockets. Several committee members from both sides have expressed strong support for the goals of the legislation. But the bill is not on today's agenda. We're working to refine the policy. Frankly, the score was a little bit more than we thought to get it in a good place so it can appear on a markup in the future. Additionally, the committee is reauthorizing the over-the-counter monograph drug user fee amendments, a MUFA, to improve the Food and Drug Administration's review of OTC drugs so they can be more quickly available while still ensuring safety. The committee held a hearing last month on enhancing a MUFA, and I appreciate Senators Banks and Kane for leading this effort and the work of Senators Marshall, Husted, and Hassan to include additional policy riders to speed up the review of sunscreen and allow more drugs to be available OTC. Senators Murkowski and Duckworth's Uniform Services Leave Parity Act fixes leave benefits for Public Health Service Commission Corps officers. It now gives them the same leave available to other members of the uniformed services. Senator Scott and Smith's Improving Care in Rural America Reauthorization Act helps address the health care needs of rural communities by reauthorizing 3 grant programs supporting access to preventive screenings, telehealth services, and chronic disease management, important pro-patient priorities for this committee. Senators Collins and Smith's Kay Hagan Tick Reauthorization Act strengthens programs to prepare for and respond to tick-borne and other vector-borne diseases which are rapidly spreading in every state. The legislation is named in honor of former Senator Kay Hagan of North Carolina, who passed away from a rare tick-borne disease in 2019. Specifically, the bill improves coordination among federal agencies, health departments, and scientists, and builds regional capabilities to respond to vector-borne disease outbreaks. I thank Senator Collins for her steadfast leadership in this issue critical to Maine, but to us all. Thank you all for your good work. I look forward to advancing these bills as part of our pro-worker, pro-family, pro-patient agenda. And with that, I recognize Senator Sanders.
Thank you very much, Mr. Chairman. I will be supporting all of the pieces of legislation that we have before us. I am pleased that you have focused attention on the need to improve and expand ESOPs and worker ownership. We live in a moment in American history where we have more income and wealth inequality than we've ever had, where we have more concentration of ownership than we've ever had. And I think we live in a moment where millions of workers feel kind of powerless as to what their economic future can be. Tomorrow, some company can announce they're moving to China or shutting down, and workers have nothing to say about that. I think an antidote to that, in fact, is what we have been talking about, and I enjoyed very much the hearing that we had last week. I think all of the witnesses were very good. How do you empower workers? How do you create a climate where workers themselves are involved in the decision-making process so that they're not just cogs in a machine? That is our goal. And I think the legislation that we're looking at today is a modest step forward. I have proposed a major piece of legislation which would enable workers and small business owners all over the country to get more information as to how they can move forward to ESOPs or worker ownerships. I know in Vermont, and I think we heard from the panelist last week, that there are many small businesses, guys who maybe started a business, worked hard, have 20, 30 employees, would just as soon leave that business to their employees if they had the tax breaks and the knowledge as to how to do that. So we need a bank of financial support from the federal government to help those workers and those employees move forward. We're not doing that today, and I hope we will do that in the near future. But having said that, Mr. Chairman, I will be supporting the pieces of legislation that we are discussing today.
Thank you. With that, I'll ask members to raise the amendments they wish to discuss. I will say that we'll vote on each amendment as it is raised, that a proxy vote will stand for a amendment. All people need to be back here, or at least on my side. You guys can take a powder. All my folks will have to be back here for final passage, and we will need you in your chair throughout that vote. But if you need to leave, because everybody has a lot of committees, then we'll let you know when it's coming back. We'll coordinate with you. Okay. With that, does anybody have an amendment they would like to raise? Oh, I'm sorry. S 2292, the over-the-counter monograph drug user fee amendments. S 1440, the Uniform Services Leave Parity Act. S 2301, the Improving Care in Rural America Reauthorization Act. S 2398, the K. Hagen-Tick Reauthorization Act. And S 2403, the Retire Through Ownership Act. And S 1728, the Employee Ownership Representation Act. I ask my colleagues to limit remarks to 2 minutes when discussing either of the bills or offering an amendment, as we have a lot to go through. And as a reminder, when discussing an amendment, please identify which amendment you are discussing by name and by number. Senator Sanders.
Mr. Chairman, I'll call up Sanders Amendment number 1 to S 2403. Mr. Chairman, in order for employee ownership to work, we need clear guidance from the Department of Labor and strong worker protections. This amendment clarifies that the Department of Labor retains the right to promulgate new regulations around the valuation of ESOPs to protect workers and to make sure that fiduciary responsibilities still apply. I thank Senators Marshall and Kane, the authors of this amendment, for supporting this amendment, for the authors of this legislation for supporting this amendment, and I hope my colleagues can support it.
Is there any discussion? Seeing no discussion, we'll move to vote. The chairman will be voting aye. Please call the roll.
Senator Paul?
Do I have my proxy votes?
Right.
Senator,
You can do yes because we changed how we're doing that.
okay. So Senator Yes is yes by. For an amendment? Oh, no, they waived it.
We waived it. Yeah.
For the information of everybody, the minority graciously waived the quorum requirement to allow us to proceed. Okay.
All right. Senator Paul?
No, yes by proxy.
Senator Collins?
Yeah, yes, by proxy.
Yes by proxy.
Senator Murkowski? Aye. Senator Mullen?
Yes by proxy.
Senator Marshall?
No by, yes by proxy.
Senator Scott? Senator Hawley?
Yes by proxy.
Senator Tuberville? Senator Banks? Senator Houston? Senator Moody?
Yes by proxy.
Senator Sanders?
Yes.
Senator Murray? Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane?
Aye by proxy.
Senator Hassan?
Aye by proxy.
Senator Hickenlooper,
Aye by proxy.
Senator Markey,
Aye by proxy.
Senator Kim, Senator Blunt Rochester,
Aye by proxy.
Senator Alsobrooks,
Aye by proxy.
Chairman Cassidy.
Aye.
I have 23 ayes, 0 nays.
Okay. The amendment passes. Do I do this one now?
Yeah.
We have a manager's amendment to S 2403. I move to adopt the manager's amendment in the nature of a substitute and to have it to be considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. All opposed, say nay. The ayes have it. The motion is agreed to. And that is the Retire Through Ownership Act. Okay. Does anyone have another amendment?
Mr. Chairman,
Senator Kim?
Yeah, Chairman, I'm not going to bring it up for a vote, but I just want to flag that I filed an amendment with Senator Banks to ensure that the OTC monograph system continues to rely on the so-called generally recognized as safe and effective standard. I understand that there's more work to be done on this to get this into shape that we want to, so I just look forward to the conversation ahead and look forward to working with the committee on it. With that, I yield back.
Senator Sanders?
Mr. Chairman, I call up Sanders Amendment Number 1 to S 1728. Given the benefits of employee ownership for working people, the Department of Labor should do everything that it can to support the expansion of employee.
Which amendment is this, Senator Sanders?
This is number 1 to 1728.
No, that was 24. Hang on, can I say this first? Do I have any more of these? Because it seems like I'm
Yeah.
a little bit behind.
We have to do the manager's amendment, so do the manager's amendment.
We have a manager's amendment to S 1728. I move to adopt the manager's amendment in the nature of a substitute and to have it considered original text for the purpose of further amendments. And this is the Employee Ownership Representation Act. All those in favor, please say aye.
Aye.
All opposed, say nay. The ayes have it. The motion is agreed to. Senator Sanders?
Thank you. I call up Sanders Amendment Number 1 to S 1728. Given the benefits of employee ownership for working people, the Department of Labor should do everything that it can to support the expansion of employee-owned businesses. This amendment builds on this bipartisan legislation we passed a few years ago to establish employee ownership centers throughout the country to educate workers and retiring business owners about the benefits of employee ownership. Specifically, this amendment would create an employee ownership council at the Department of Labor and require it to be appropriately staffed. It would also establish a 7-member advisory council on employee ownership at the Department of Labor. This amendment should be non-controversial, and I would ask my colleagues to support it.
This is on 1728,
Correct.
Sanders 1.
Right.
It says
Yes.
yes.
Is there any comments, questions, or anything on this amendment? Seeing no, we'll move to a vote, and the chairman will be voting aye.
Senator Paul,
Yes.
Aye by proxy?
Senator Collins,
Aye by proxy?
Senator Murkowski, Senator Mullen,
Aye by proxy?
Senator Marshall,
Aye by proxy?
Senator Scott, Senator Hawley,
Aye by proxy?
Senator Tupperville,
Aye by proxy?
Senator Banks, Senator Houston, Senator Moody,
Aye by proxy?
Senator Sanders,
Aye.
Senator Mullen, would you like to be recognized as an aye by?
All right. Senator Mullen, aye. All right.
And Senator Cassidy is an aye.
Okay. Senator Murray,
No.
Senator Baldwin, Senator Murphy,
Aye by proxy.
Senator Kane,
Aye by proxy.
Senator Hassan,
Aye by proxy.
Senator Hickenlooper,
Aye by proxy.
Senator Markey,
Aye by proxy.
Senator Kim, Senator Blunt Rochester,
Aye by proxy.
Senator Alsobrooks,
Aye by proxy.
and then Chairman Cassidy.
Aye.
I have 23 ayes, 0 nays.
Okay. Does anyone else have another amendment?
This is an amendment that she wants to offer. Okay, this is an amendment Hassan wants to offer.
On 1728.
Yes.
Senator Sanders.
I'm going to offer this amendment for Senator Hassan on S 1728. Mr. Chair, I would like to offer Hassan Amendment 1 to S 1728, the Employee Ownership Representation Act. This amendment would establish the position of employee ownership advocate at the Department of Labor to support the formation and success of employee ownership. I appreciate the Chair's partnership on this amendment and will note that the ESOP Association and the Employee-Owned S Corporations of America support this amendment as well. I will ask for a vote at the appropriate time and ask for my colleagues' support.
Okay. Any comments on Hassan number 1 on 1728? Seeing none, we will go to a vote, and I shall be voting aye. Clerk, call the roll.
Senator Paul,
Aye by proxy.
Senator Collins,
Aye by proxy.
Senator Murkowski, Senator Mullen, Senator Marshall,
Aye by proxy.
Senator Scott, Senator Hawley,
Aye by proxy.
Senator Tupperville,
Aye by proxy.
Senator Banks, Senator Houston, Senator Moody,
Aye by proxy.
Senator Sanders,
Aye.
Senator Murray, Senator Baldwin, Senator Murphy,
Aye by proxy.
Senator Kane,
Aye by proxy.
Senator Hassan,
Aye by proxy.
Senator Hickenlooper,
Aye by proxy.
Senator Markey,
Aye by proxy.
Senator Kim, Senator Blunt Rochester,
Aye by proxy.
Senator Alsterbrooks,
Aye by proxy.
Chairman Cassidy.
Aye.
I have 23 ayes, 0 nays.
Okay. We'll now move to consideration of S 2292, the over-the-counter are there any more amendments on 1728? Seeing none, I will now begin with consideration of S 2292, the over-the-counter monograph drug user fee amendments. And before I introduce the manager's amendment, I recognize Senator Jim Banks, the bill sponsor, to introduce the bill. Senator Banks is recognized for 2 minutes.
Thank you, Mr. Chairman. I'll be very brief. The over-the-counter monograph user fee authorization amendments are a common-sense reform to the FDA's process of reviewing and approving non-prescription drugs that Americans use every day. I want to thank the chairman, Senator Kane, especially for working with me, Senator Kim, Senator Husted, Senator Hassan, and the FDA for working with me to reauthorize AMUFA through 2030. Reauthorizing AMUFA saves taxpayer dollars and it helps the FDA work more effectively, speeding up the approval process and making reforms that will do even more with less money. With the $32 million that AMUFA collected just last year alone through user fees, that's money that can make the FDA more effective in their approval process. With that, Mr. Chairman, I yield back.
Thank you. We have a manager's amendment to S 2292, which I move to adopt in the nature of a substitute and have it considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. Opposed, say nay. The ayes have it. The motion is agreed to. Before going forward, I also want to thank Senator Paul on his amendment to advance non-clinical testing. Supporting non-clinical testing methods is important so that we don't limit ourselves to unnecessary frameworks that in turn limit medical innovation. I look forward to working on this policy for a markup soon in this committee. Senator Husted.
Thank you, Mr. Chairman. Appreciate the opportunity to talk just a moment about the smart OTC legislation that's included. We know that over-the-counter medicines save American patients around $170 billion annually. These medications play a vital role in keeping American patients healthy and reducing strain on healthcare providers. I'm proud to introduce, alongside Senator Hassan, the Streamlining Market Access Reform for Therapeutics, or SMART OTC Act, to make it easier for FDA to approve prescription drugs for over-the-counter use. The SMART OTC Act directs the FDA to explain clearly what types of drug categories might be candidates for patients to access over the counter. It also provides a framework for FDA to engage with sponsors of new applications. I would like to thank Senator Hassan for and her staff for working with me on this important issue. It will improve patient access and give more options. The bottom line is that this provision will improve access to medications in a safe and affordable manner, and it's good progress for American consumers. Thank you, Mr. Chairman.
Thank you, Senator Husted. Does anyone have an amendment they would like to propose? See no more amendments, we'll now begin consideration of S 1440, the Uniformed Services Leave Parity Act. I recognize Senator Lisa Murkowski, the bill's sponsor, to introduce the bill. I'll note there is no manager's amendment on this. Senator Murkowski is recognized for 2 minutes.
Thank you, Mr. Chairman. I'm pleased to be able to introduce this measure with Senator Duckworth. This is an effort to provide parity to the Uniformed Services, the United States Public Health Services Commission Corps. It's a mouthful. The Public Health Services Commission Corps is the only uniformed service with a public health mission. We have seen them in our states when there are emergencies, natural disasters, they are there. But unfortunately, this is the only federal entity, these officers are the only federal entity, both uniformed and civilian, without access to parity when it comes to certain benefits. That they are the only ones to not have extended parental leave, literally the last federal service members without that. Their counterparts in all uniformed services receive comprehensive leave benefits under Title X. So this is an effort, again, to make sure that recruiting our healthcare professionals across the country is equitable and fair. So what we do is extend Title X leave authorities to the Public Health Service Commission Corps, ensuring that we have consistent standards across all our uniformed services. We eliminate bureaucratic inefficiencies by aligning the PHS within the existing framework, like we do with TRICARE, military pay, and other benefits. So this is about basic fairness regarding those who are serving us, and I would urge all of my colleagues to support.
Are there any amendments to this bill? Seeing none, we shall proceed. Next, we'll go to S 2301, Improving Care in Rural America Reauthorization Act of 2025. And we have both bill sponsors here. I'll start with Senator Tim Scott. Tim Scott, the bill sponsor, to introduce the bill.
Thank you, Chairman. It's been a pleasure to work with my colleagues on this committee and co-sponsors of the bill, including Senators Smith, Lummis, and Kane, to pass legislation that improves the health of all communities, but specifically rural communities. This bill improves access to care for the rural communities. Over 30% of South Carolinians and 1 in 5 Americans live in the rural areas. Access to care continues to remain a challenge, and these HRSA programs are vital to bridging those gaps. The act includes language to make sure these funds not only go to rural communities, but also include local community involvement and how these programs are run. Rural health care isn't a red or blue state issue. In fact, many of my colleagues on this committee have received an email from my office on how these programs and grants have impacted their states. The data is clear. These programs improve health outcomes and should continue. I look forward to passing this bill out of committee today, and I urge all my colleagues to join me in supporting those bills. Thank you, and Senator Kane, thanks for working with us.
Mr. Chair, I just want to thank Senator Scott and others for working on this bill. Very, very important. I also was late and didn't get a chance to speak on the bill that I've worked on with Senator Banks, which was the predecessor, but I think that'll probably increase its odds of success that I was late and didn't speak on it.
And you're welcome, by the way, you're welcome to speak on it, because frankly, we're trying to kill time.
Boy, encouraging a senator to speak is a very dangerous thing. But on this one, the Rural Health Act, Senator Scott did a good job of kind of laying out what it is. It's reauthorization of 3 really important programs in Virginia, and I suspect in many of your states, these programs, the Rural Health Care Services Outreach Grant Program, the Rural Health Network Development Grant Program, and the Small Health Care Provider Quality Improvement Grant Program have really these all have provided some really valuable assistance. In Virginia, Rappahannock County is one of our smallest. They just got their first stoplight. I mean, it was a big occasion. Page and Shenandoah are somewhat larger counties in the Shenandoah Valley, but they've really benefited from these programs. Horizon Behavioral Health in Lynchburg is a really important behavioral health local NGO that received funding to provide access to essential health services. I'm proud of this work, and reauthorizing the legislation together with Senator Scott and others is an important step. Thank you.
And did you want to comment on the ESOP?
I think that one is still to come, right? I don't.
No,
think
we've
that-
already done ESOP.
We've already done ESOP? Okay, all right. Well, then let me thank Senator Marshall, who is not here, but Senator Marshall and I worked together on this ESOP issue that I think many of us who attended the hearing last week, it was a very good hearing, kind of digging into, boy, we'd like to have more ESOPs. What are the obstacles to having more ESOPs? And one that all the witnesses testified to was the challenge of finding the right valuation for the stock of a company when it is going to be sold to the employees. Obviously, the owner should get fair market value for the sale. Shouldn't have to take a discount because he or she wants to do the right thing and sell to employees. But setting that and then not having the owner charge too much so that the employees get saddled with excess debt is a huge issue. And a lot of folks who want to go into the ESOP are worried that the Department of Labor will come back years later and say, wait a minute, that wasn't a fair valuation. So the bill that Senator Marshall and I have is a bill that uses a lot of IRS precedent about how to value small, closely held corporations. And if the owner selling to employees follows that general guidance, there will be a safe harbor and there cannot be a subsequent action against the owner. So it just basically does, oh, and get this, DOL was supposed to do regulations about valuation. For 50 years, they haven't. They've started and stopped a couple of times. But this would finally establish a principle. Senator Sanders proposed an amendment that Senator Marshall and I thought, very friendly amendment, clarifying something that we agreed should be included. So I think the bill is in good shape, and it will be one of the things, according to our witness testimony, that could facilitate more ESOPs from being formed.
Sounds great. We have one more bill to introduce, and that will be Senator Collins's, the Kay Hagan bill.
You can do the manager's amendment, and we can do a technical conforming, and then we can wait, because we got to get members here anyway.
I will introduce the bill, do the manager's amendment, have her come and formally give her 2 minutes, and then we'll move straight into final vote, at which point people can leave. Okay? So, and just again, for all my folks, we'll need you in your chair for final passage. Okay? We'll now begin consideration of S2398, the Kay Hagan Tick Reauthorization Act. Before I introduce the manager's amendment, I would like to, well, I will, when she arrives, recognize Senator Collins. But in the meantime, we do have a manager's amendment, S2398. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All those in favor, please say aye. Aye. Opposed, say nay. The ayes have it. The motion is agreed to. I now move to authorize staff to make any required technical and conforming changes when preparing S2292 and S1440, S2301, S2398, S2403, and S1728. All those in favor say aye. Aye. All opposed say nay. The ayes have it. The motion is agreed to. I also ask unanimous consent to enter several statements of support for the bills being considered today, entered into the record. I see no objections. Okay.
Mr. Chair,
Senator Kane.
are we still stalling for time or no longer stalling for time?
We are stalling.
Can I say something about Kay Hagan?
Please.
I'd like, many of us were here with Kay, some of us weren't. And it's really, really important to name this bill after her. Talk about a tragedy. She was a great senator. She lost a reelection bid, very healthy, active person. And she went on a hike in Southern Virginia, not far from where she lived. After that hike, she went to Africa on a trip and came back and had a very debilitating stroke. And everybody thought she must have gotten something in Africa. So they ran all kinds of tests on Kay, and they couldn't find out what was wrong with her. And it turned out that this tick very close to home had bitten her, and she got Powassan virus. So, you know, we're all familiar with Lyme disease, Rocky Mountain spotted fever. I don't know what the one is that confers the allergy to red meat. These are significant ones, but Powassan virus is a lesser one, but that is very serious. And it took months for her to be diagnosed what the actual cause was. She was in a treatment facility in Atlanta for a long time with her husband, Chip. They're by her bedside month after month after month. Eventually recovered enough to come home. She was able to be at some events, some ribbon cuttings for some things that she had, you know, like an airport in her community that she had something to do with, but died because of this tick-borne disease that was not diagnosed properly, although even if it had been diagnosed, there may have been nothing that could have been done about it. I know those of us who served with Kay really loved her kind of sparkle and her energy and her activism, and I'm really happy that Susan in this bill has
Senator Hassan, we're about to vote, if you have a minute.
has honored Kay.
Got it.
So we're going to vote en bloc.
Okay. We will vote now en bloc because this is bipartisan. There's bipartisan support. We can pull it off, and I will wait here till Susan can come back, Senator Collins can come back.
En bloc on those bills.
We're now going to vote en bloc on S 2292, S 1440, S 2398, S 2301, S 1728, and S 2403. The clerk shall call the roll.
Senator Paul,
Aye by proxy. As amended. We'll vote on these en bloc as amended.
all right. Senator Paul,
Aye by proxy.
Senator Collins, Senator Murkowski, Senator Mullen, Senator Marshall,
Aye by proxy.
We don't do proxies.
Oh, we don't do proxies. Never mind. I'm sorry.
Senator Scott. Oh, yeah, you can. Oh, aye. Yes, yeah. Senator Hawley, Senator Tuberville, Senator Banks, Senator Houston, Senator Moody,
Aye by proxy.
Senator Sanders,
Aye.
Senator Murray, Senator Baldwin, Senator Murphy, Senator Kane, Senator Hassan, Senator Hickenlooper,
Aye by proxy.
Senator Markey,
Aye by proxy.
Senator Kim,
Aye by proxy.
Senator Blunt Rochester,
Aye by proxy.
Senator Alsobrooks,
Aye by proxy.
Chairman Cassidy.
Aye.
Are we going to hold for Senator Collins?
Yes, well, do people need to stay?
No. Well,
Coming back to speak.
you want, yeah,
She's
so
just
aye
coming
by
back.
proxy then?
Then she's an aye by proxy.
Aye by proxy.
Okay,
All right. I have 23 ayes, 0 nays.
great. Thank you all. Thanks, Bernie.
Can speak.
And we will keep it open so she can speak.
Oh, I'm sorry.
Senator Collins, would you like to be recorded as present?
Yes, Mr. Chairman, I would, in favor
And
of
put your microphone.
the bills.
Okay.
Mr. Chairman, I would ask unanimous consent that I be recorded as present and as voting in favor of the bill.
Without objection?
Mr. Chairman, with your indulgence, I would love to make a few comments on the TIC Act, if you have time.
Please.
Thank you very much, Mr. Chairman. I, first of all, want to thank you for including S 2389, the Kay Hagan TIC Reauthorization Act, in today's markup. I authored the original TIC Act in 2019 with Senator Tina Smith. Our bipartisan legislation strengthened federal efforts to confront the escalating incidence of Lyme disease and other vector-borne illnesses. Our bill is named after our former colleague, Senator Kay Hagan, who passed away in October 2019 from complications of a deadly tick-borne disease known as the Powassan virus. It is my hope that reauthorizing the TIC Act will help to prevent further tragedies. The incidence of tick-borne diseases has exploded in the past 20 years. Maine reached a new Lyme disease record last year with 3,218 reported cases. This is more than double the number of cases reported in Maine just 5 years ago. I'm encouraged that we've made progress in the 5 years since this bill was first introduced. For example, a clinical trial for Lyme disease vaccine for people is underway right now at Maine Health's Institute for Research. Reauthorizing the TIC Act would allow crucial developments such as the development of a vaccine to continue. The TIC Act uses a three-pronged approach to address Lyme and other tick and vector-borne diseases. This approach consists of first implementing HHS's national strategy to combat vector-borne disease. Second, reauthorizing funding for the CDC's 4 centers of excellence in vector-borne disease. And third, reauthorizing grants to state and local health departments to assist them in bolstering their public health infrastructure. I want to thank Senator Smith for partnering with me, as well as our 13 bipartisan co-sponsors, including members of this committee, Senators Marshall, Hassan, Hawley, Hickenlooper, and Banks. Again, Mr. Chairman, I'm very grateful for your including this on the markup agenda, and I'm delighted that we're going to report the bill today. Thank you.
Thank you.
Mr. Chairman,
Senator Marshall.
I would ask unanimous consent to be counted as present and voting aye on all the, on the bills today.
Without objection.
Let me add just one thing on the Lyme disease. I appreciate the senator working on that. The big news that I have is that we now have a blood test to tell the difference between long COVID and long-term tick diseases as well. And we didn't have that available because they look a lot alike clinically. So excited about that new finding.
That's great. And knowing that your personal interest in long COVID.
Thank you. I yield.
Also, in closing, I want to thank the ESOP Association for their partnership. We had 2 really good ESOP bills today, and we wouldn't have been able to have them so good without their active participation. This concludes today's business hearing. This